just a couple of minutes before we officially get started, but I want to thank all of you for your interest in today's topic. I also want to thank you for all that you're doing here in Howard County to continue to keep our community safe, to continue to grow our economy. And also I want to thank you for your continued support of the Chamber. Certainly opening up our different businesses and the like is of paramount interest to all of us, but certainly we want to continue to do it in a safe manner. But I think as we've started having more conversations about opening as of late, there's certainly a widespread interest as to which businesses can open, when, which types, for how long, what's the capacity, why can't they open if they can't, et cetera. And so we're going to cover a lot of these topics today with our county executive, as well as any of his team that needs to join in and share their additional insights as well. And if there's a question that is asked that perhaps we can't answer today, we will certainly make sure that we get that information and follow up accordingly. Today's webinar is also being live streamed and will be held on YouTube as well. And so if there's anything that's said or missed, you'll be able to go back and visit there. Lastly, before we get started with the questions, a couple of other just quick housekeeping issues. The first is want to just, again, publicly acknowledge and thank all of our 2020 annual partners. As you can see the different business and corporate logos behind me. Certainly the Chamber would not be able to have survived without their support. And so we always want to make sure that we are publicly acknowledging and thanking them for their continued support of the Chamber and really of the Howard County community. The second thing is for all questions today, I'm going to ask that you submit them through the question and answer portal as opposed to the chat. Again, if you would submit your questions through the question and answer. We have also provided and have been in conversation with the county executive on a number of core questions beforehand that we think will answer a lot of the questions that you have and concerns, but certainly we want to make sure that everyone has an opportunity to ask any other questions as well. So with that, I am going to stop talking for a moment and turn things over to our county executive, who will open things up with some general comments, perhaps announcements, observations, and then from there, we'll jump into the question and answer. So with that, County Executive Ball.
Well, good afternoon, everybody, and thank you so much for joining. And I want to give a special thanks to Leonardo and the Chamber team, as well as my team who's on, Jennifer Jones, Shana Hernandez, and EDA and Larry. Everyone has been working so hard and so diligently through this unprecedented time. And I wanted to personally thank you for your leadership, your collaboration, your partnership. So as you know, COVID-19 pandemic has caused significant upheaval. And I was talking with some other county executives, not just around the state, but also previous county executives, and many of them indicated there is no playbook. And so we're all, whether you're a business owner or county executive or governor, trying to work through this. And I know that our business owners have struggled as your businesses have closed your operations or had to curtail them significantly. I know that parents who are now working from home, trying to balance our children digitally learning and the understandable stress and anxiety have had a lot of great difficulty. And I know that across the state, we've been seeing jobs disappearing, and we've seen a great deal of frustration with infrastructure and systems that were never built to deal with a great deal of volume at a short period of time. And recently, as our state has begun to open, I know that there are business owners and employees and customers who have been quite eager and excited to get back to some sense of normalcy. Whereas there have been others who have frankly been quite concerned and hesitated. At the government level, please know that our priority has been and continues to be the safety and health of our residents and those who visit Howard County. And every decision that we make is with those priorities in mind. So as we begin and continue to reopen, we've been trying to move forward responsibly, innovatively, effectively, and safely. So on May 13th, when Governor Hogan announced that many of the decisions regarding reopening would be left to local jurisdictions, I made some difficult decisions based upon the data that we had, and we kept certain restrictions in Howard County. At that time, our data showed that we weren't quite as ready to go as far as the governor's order. Our ICU utilization rate at Howard County General Hospital, and that's one of the key indicators to show that our hospital has the surge capacity to take on more patients. It had risen 2 consecutive days and continued to rise 3 days after the governor made his announcement. And that 5-day stretch of increases was the most consecutive increases in ICU utilization rate that we had seen in Howard County. In the 2-week period before the governor's announcement, which started April 26, we saw confirmed cases increase an average of 33 cases per day. The 2-week prior to that, we only saw them increase 27 cases per day. And our ventilator utilization rate, which is another surge capacity indicator, was nearly 68%, fewer than 10 days before the governor's announcement. On May 14th, the next day, we released our HOCO RISE document, which is a living document and a framework that outlines the county-specific metrics that we track and how we make certain decisions when it comes to reopening. HOCO RISE also details our progress on the 4 building blocks laid out by the governor in his Maryland Strong Roadmap to Recovery. And since announcing HOCO RISE, we've made several strides and more progress in those metrics, and many of the data have shown promising trends. For the 2-week period beginning May 10th, after spiking to 78.8% on May 15th, the ICU utilization rate has fallen or stayed the same for 7 of 14 days. And as of May 23rd, was the lowest since April 1st. Our ventilator utilization rate for that same time period was 18.6%. And our average daily confirmed case count, which we expect to rise with more testing, is actually back down as of that point to 27 per day. We have also increased the number of contact tracers from 2 people before this pandemic began, and now 35 people. And we also have enough PPE for 30 days. For over 2 months, we've connected regularly with local business owners, religious organizations, other entities, and we know that many are still anxious about reopening. But there's a lot of real fear. And I want to remind everyone that as we're going through this challenging time, the real enemy is COVID-19. It's not other businesses or people who might not share our views or understand all the data that each of us might have access to. It's COVID-19. I also speak regularly with our health officer, Dr. Rossman, and we've had a lot of thoughtful conversations about reopening and best practices that we're seeing, not just around the state, but around the nation. So based upon the progress that we've made on the governor's 4 building blocks and our favorable trends that we have been seeing, I announced yesterday that effective Friday, May 29th at 7 a.m., All retail, barbers, and hair salons may open at 50% capacity, and religious institutions and gatherings may resume outdoors for up to 250 people. And yesterday, I signed an executive order to put out specific guidance for each of those industries to maintain safe environment for employees, customers, and congregants. In coordination with our health department, we continue to work with our businesses and our owners in the retail, hair salon, barber, as well as restaurant, fitness, and other sectors, so that we can continue an iterative process of getting feedback and moving forward together. We also have a broader advisory group consisting of various industries, including manufacturing, restaurant, food processing, healthcare, cybersecurity, childcare centers, and others. And this will hopefully facilitate a smoother reopening because we're in this for the long haul together. And while we're pleased with our progress, we're not going to become complacent as we enter into new phases of opening, and we will continue to lift restrictions driven by our data. COVID-19 isn't going away in the near future, and as we've seen in other states and jurisdictions, if we don't move intentionally, we could erase the gains made by the sacrifices that we've made to this point. Our goal is to reopen as safely and as effectively as possible and continue flattening the curve. And please know, there isn't one elected official who I know of any political party or stripe who doesn't want to support business, economic development, and a thriving economy. We all want to reopen as quickly as we can, as safely as we can. And so I know that through HOCO Rise and us working together, we can do that, and we can get through the other side of this, not just hopefully many of us, most of us, all of us, being in a better place than we would have if we weren't working together. Thank you.
Thank you. And so from there, we're going to start with some questions that we've prepared on this side, as well as some that are in the question and answer section. And as you were talking, I was thinking that we may try to group these in terms of perhaps processes and maybe data and things that are driving your decision making. And then from there, shift into maybe facilities. And then lastly, kind of talk about maybe some more county specific areas, such as whether it's camps and so forth. So going back to processes, I know you touched on the fact of one of the, I guess, top tests that you looked at in terms of determining whether to open or not, and it tied back to the governor's guidelines. But if you could maybe perhaps just share what might be a top 3 or 4 things that you look at collectively that says, okay, you know what, I want to stay with the governor's phase 1, or I want to deviate, or what have you. So certainly we knew that the hospitals were one, but are there other factors that you were considering that you weighed perhaps more heavily than others?
So I think, honestly, we are looking at, for the most part, all of the same data. I think where there is sometimes a little shift is there are differences in the data based upon local jurisdictions. For example, if the governor looks at PPE, he might be looking at all 24 jurisdictions, where in Howard County, we're evaluating our individual burn rate. We're looking at how many dentists or other doctors' offices might be opening, and whether or not our PPE, which has happened, got co-opted by maybe other governmental entities. I don't know if you all read that there were certain points during the purchasing and procurement breakdown where the federal government was rerouting PPE. So I think there are numerous factors that we all consider that are germane to our particular jurisdictions, confirmed cases, which of course we know that as we have more tests, there are going to be more confirmed cases. However, we don't just look at the confirmed positive cases, we look at the negative cases and we evaluate the positivity rate, which we are told should be at the top of the sphere, 10% with a goal of 5%. During the governor's announcement, we were at 18.2%. So we need to improve our testing capabilities. Again, we talked about surge capacity, hospitalization, number of patients admitted to the ICU. So there are numerous factors that we look at. And frankly, again, because we are in unprecedented times, we're going to continue to learn. We're going to continue to evolve in our thinking to keep people safe.
And on that same note, so you talked about PPE. Are there other resources perhaps that we need in Howard County that we currently lack that ultimately would also kind of maybe hinder the speed or the pace that we're able to open?
Great question. So one thing is when we look at PPE, there are numerous things, whether it's masks, face shields, gloves, syringes, gowns. And there could be times where we've seen certain processing plants shut down because of an outbreak. And then that impacts that particular thing that they're making for sometimes the entire country. Or we've seen some of our small businesses in the county, in the state, and the region that have repurposed what they're doing. And so maybe we had a dearth of hand sanitizer, but then we saw one of our distilleries repurpose. So at any given moment, we could be in a really good place or really challenging place, or we have a certain burn rate. But then as our calls for service for our fire department and emergency medical technicians go up because maybe there's an outbreak, if that goes up 3 or 4 fold, well, maybe our burn rate will then go up 3 or 4 fold. So maybe we have assessed for the next 30 to 45 days what we might need, and then all of a sudden we need more. And again, as we're right now in an okay place, we have 30 days worth, but this thing could continue to go on for much longer than 30 days. What if it goes into the summer, the fall? What if there is, unfortunately, another procurement breakdown in the supply chain for gowns as elective surgeries have gone up, or many dentists come online, or frankly, many of our retailers who are saying, all right, we're going to open, but we're now going to use hand sanitizer. So we're looking at the 10,000 plus or minus businesses in Howard County as they begin to come online. There will be a competition for all of these PPE things. So this is constantly a moving target.
Thank you. And another thing you touched on was the conversations that you're having with your colleagues or your peers in other jurisdictions. And so there's been, I guess, maybe a lot said, I don't know if it's been said publicly or at least privately, in terms of talking about the coordinated efforts between what might be deemed the Big Eight in terms of the county executives and mayors and so forth. And so can you talk a little bit about the collaboration that you have with, say, a Prince George's County, a Montgomery County, Baltimore City, et cetera, and how does that, I guess, conversation or collaboration influence decision-making in Howard County, or does it not influence decision-making here in Howard County?
So the largest 8 jurisdictions, which includes Howard, account for between 80 and 90% of the cases. And so we often have conversations about what we're seeing. We might sometimes say, hey, you know, I found an entity that's going to sell gowns, and they just came online, and many of you didn't know, and it's in my jurisdiction. Let me give you that point of contact. Or, for example, one of the challenges that we had early on was the CARES Act funding. The way that it was structured was only the jurisdictions that had 500,000 or more people got a direct deposit into their account. So when you saw Prince George's, Montgomery, Baltimore County, Baltimore City, Anne Arundel stand up programs immediately that were for businesses or what have you, there was, you know, million, 2 million, 5 million, 10 million. A lot of them got a direct deposit of $100 million from the federal government. Those of us who had fewer than 500,000 had to go through the state. And then the state would set up certain guidelines, and then they would say if we adhered to certain guidelines, we could get half of the money. And so it really added a level of bureaucracy. And so just talking with our colleagues about those experiences and then having that ongoing conversation with the governor and helping him and his team understand the implications, because again, things are evolving quickly and none of us have done this before. And so those continued collaborations, conversations, areas where maybe we're recognizing that we're having a challenge with getting tests or the swabs for the tests or the reagents. Well, talking with the other jurisdictions, maybe they're all having those challenges, or talking with the governor, maybe everybody in the state is having those challenges. So we can magnify our voices and understand this is not just specific to a particular jurisdiction. This is the Maryland or the DMV or the national or even the world milieu in which we find ourselves. So how can we get around it? What are we learning from each other? You know, it's very similar to any other industry, talking to other people in the industry, whether it's restaurants, salons, barbers, and you know, maybe we see there's no barbicide or they're not getting potatoes from a certain area, and being able to understand how are you dealing with this issue and what are you seeing? And are you seeing prices increase or decrease or getting them from another area?
And I think that actually gives us a really good segue into, so the announcements yesterday. You created, I guess, an executive order that pertain to retail establishments, barbers, as well as also, I think there might be church, religious institutions. And so talk a little bit about that. I know we've got several questions in the question and answer that pertain to that. I know one on the religious institution side pertain to the fact that on retail, we opened up based upon square footage. I believe that's what it was, or at least size of the establishment, perhaps would dictate the size and the number of people that could come in at a time. And so a similar question that came up here was, why are businesses allowed to open up at 50% capacity based on size, but churches only allowed to have 10 people indoor, no matter how big that particular building might be? And so if you could touch a little bit on, again, the decisions just overall as a whole from yesterday, because I know there was another question in here that pertains to salons, but there are a few in here that's looking at religious institutions as well. So if you could just cover that announcement from yesterday.
So as I indicated, we've been having numerous conversations, not just since the governor reopened, but for several weeks with different entities, including many of our faith leaders. And so we wanted to have something that not only worked well in theory, but in practice. And I think, you know, many of our business owners on the call have not only just heard or seen, but experienced the difficulty when there's something that comes through that's unclear, or there are people who aren't necessarily in that industry who are making the exclusive decision and not talking with anyone in that industry. So in the iterative conversation with many of our faith leaders, one of the things that was very clear and apparent was the vast majority of them were not comfortable opening at this time. Even with the 10, many of them are much more comfortable staying online or doing what they've been doing for the last several weeks, and have communicated that to their congregants. For the conversation about what would make sense, you know, having 50% capacity for some of these congregations that have 2, 3, 4, 5,000 members means that now you might have, you know, half of that, maybe up to 2,000 people in a space for 1, 2, 3 hours at a time. Whereas in retail establishments, oftentimes, ideally, is you have people go in, they go in for the things that they need, they make their purchases, and then they move on. And they don't have direct contact with any one person for a long period of time. And also, many retail establishments, you have people coming in and out, you have the doors open, whereas oftentimes throughout church services, there are silent portions, there are portions where you close the door. So in those conversations, and it was interesting, I was watching one news program yesterday, and the person said, and we contacted several religious organizations, and none of them had planned on opening this weekend. So I know that there are many people who have concerns. We will continue to work with folks. But again, we're talking to people in the industry. And when it comes to our faith leaders, the vast majority of them not only are very pleased we've had these continuing conversations, but do not plan on opening the doors that widely at this point.
And on that same note, as we talk about certain industries, let's maybe shift to also talking about retail as well as also restaurants. And so I know with retail, there's the allowing of curbside service in terms of if you, I'm going to almost maybe call it a site to store where maybe you just drive by and you pick it up or what have you. But talk a little bit about the retail as well as specifically, because I know there's a question in here about the mall in Columbia and perhaps when how does the mall factor in here? And obviously, and while this question in the Q&A may pertain to the mall, it could easily be related to Savage Mill or other places where there is a large building that has multiple tenants. So if you could talk about that, and then also maybe shift into talking about restaurants, because that's another big one as well that many people want to know. When can they go and patronize their favorite eatery and actually maybe sit inside? Or if I own a restaurant, when might I be able to open? So if you could talk a little bit about retail and restaurants.
So we talked a lot in the conversation about HOCO Rise about the specific health-related measures and factors that we're taking into consideration. We also hear from numerous people throughout our community and residents who talk about issues that they want us to think about. Those workers who say, well, now that transportation has been significantly curtailed, I don't know if I can get to work. Or I have kids at home and I'm not comfortable. I'm taking care of my ailing parents. So although I may not be in the vulnerable category, knowing that we're learning anywhere from 10 to a third of the people, and that's based on what we know now, could be walking around asymptomatic, they're not comfortable. Or as we're seeing other jurisdictions that have opened up more earlier than us, many of them still didn't open up because either they didn't have their PPE in place or they weren't able to have a certain intervention. So the curbside was a way to help not only have businesses open at certain levels, but also make sure that our residents had access to some of the things they need. We know for many businesses that's not sustainable for the long term, and we appreciate the patience and the understanding. So as we continue to open up, and we'll see more on Friday, having that 50% capacity, we'll see, hopefully people will continue to physical distance, wear masks, wash their hands frequently, and the other health-related metrics will work. On the restaurant side, we know that many restaurants are often working at around the margins anyway. And so this has been devastating. And for not just our restaurant industry, but for many of our businesses, the difficult decision of layoffs is like breaking up a family. And so I fully understand and appreciate that. However, when it comes to the fullness of time, and we look at health, when we look at potential deaths, there needs to be the thoughtfulness of the health and safety of our community. And we're going to continue having conversations with the governor, with the restaurant association, with others to see how we can open as quickly as possible, but also as safely as possible, and what interventions are feasible and implementable that will actually help not just the restaurants open, but also ensure that the employee safety is addressed and that our patrons are comfortable coming in. Because most people, if they don't feel safe, even if you open the doors, still aren't going to come, and you're still not going to be making the money. The community needs to have faith that we as the leaders and those who are working with the leaders are making the right decisions that are beyond exclusive economic decisions, but are also looking at the health, safety, and welfare of people. Oh, the mall.
So I know you mentioned.
Let me briefly talk about the mall and Savage Mill. So we were one of the first jurisdictions to close those down. Again, those are often large gatherings. People go, especially younger people, hang out, or some of our older adults go there and exercise. What we wanted to do and what we've done thus far is still make certain things available, but address the large gathering issue, address the hanging out and the close contact for things that aren't essential, that can be done outside, and try to find that balance. And we stay in close contact with the mall and Savage Mill so that we can have that collaborative process moving forward.
And speaking of collaboration, I know that also there's been discussions of having a, I guess, similar to what we saw Governor Hogan have on the state level, but having it on the Howard County side, a COVID-19 task force, if you will, that would be comprised of various industry representatives that could be able to provide some insights and guidance, just because we know that each industry, and even within an industry, there are these nuances that come up that without having that dialogue, you may not know about. So if you could, again, share a little bit about where that task force is in terms of either status, perhaps what might be the industry segments that are represented, participants, et cetera.
Excellent question. So we started internally with just the work groups of various department heads dealing with the things that we needed to know on the inside. And then we also talked with many of our partners, whether it's the Chamber, Economic Development Authority, CA, the library, the community college, the hospital, all these various entities to get different perspective. And then as we continue along the reopening, talking, as you very astutely noted, with industry professionals, because there are certain things that are germane to barber and salon industry that might not be germane to restaurants or bars or fitness or recreation. And so then we pulled together teams of folks for those areas. And so having those conversations, hey, what are you seeing in your industry? What do you think makes sense? Okay, well, walk me through the process of you dealing with a customer, and how can we mitigate the spread, not only for the customers, but for your employees, and then coming up with those dialogues and then those regulations that people can actually implement and are clear. And so that is a continuing process that we're doing as we're continuing to learn, and as we're seeing things around the country that might make sense, good best practices that we can integrate just like any other time.
And this next question that I'm taking here as I scroll through, that is that's good. So as we talk about facilities opening, certainly let's shift even talking about the county buildings and facilities themselves, and particularly you guys see a lot of people come through their doors, whether it's going to the planning department or going to building licensing and so forth. So if you could talk a little bit about the conversations you're having, just even as it relates to county facilities, particularly this one question states, will you be doing an indoor air quality, will you be studying indoor air quality levels in government buildings and schools prior to reopening the facilities? And if so, what standards might be used?
So yes, we did close down our government buildings, and we have about a third of our 3,000 plus or minus workforce teleworking or working from home. And then many others are still out doing essential things, and making sure that, as we've done throughout this entire process, our government is still fully functioning and serving the residents and businesses and workers who need us. And so that has been a challenge. We are also in the midst of this pandemic, looking toward the future. What are some of the technologies and the research that are on the horizon? You know, we've talked a lot about testing thus far. In that, I've been exclusively focused on diagnostic testing, but what is going on with the serology testing or things like antibodies, where the FDA has been looking at either approval or authorization, and that research continues to unfold. What about UVC lighting and how that works, and what are the impacts of that? And then, as you indicated, air quality. So these are some of those emerging sciences and technologies that we're continuing to look at and see how best to apply in Howard County to not only reopen us as safely and as quickly as possible, but make sure that we're effective, we're innovative, and we try to stay open while keeping people safe. So these are all things that we're still studying.
Thank you. And so another topic that is, on the mind of workers, parents, employers is that of childcare. And so again, we're starting to move towards summer, and there's a big question as it relates to camps and pools and those type of facilities. So if you would give an update on, I guess maybe a couple of things. One, will pools be opening anytime soon, for one? But I think another, maybe even broader question is, certainly we know Howard County has a fantastic Recs and Parks department that leads a number of different camps that often take place at our schools, as well as at Roger Carter and other places. So share with us a little bit about the conversations around summer camps, pools, and maybe even broader childcare, because that is definitely a huge topic for workers and employers.
So yes, childcare having been shut down was something that I think people needed to consider. Even if we reopened everything 2 or 3 weeks ago, not having childcare available would still very adversely impact our workforce and our ability to deliver services. So that needed to go in tandem, understanding how we can open up our childcare centers for our workers in a way that still help them not only keep kids safe, but as kids could potentially be transmitting it to other generations in the household. How do we address that? Not every kid, especially as they're younger, understands physical distancing. Many of them aren't so good at washing their hands for 20 or 30 seconds and being thorough. So these are some of the things that needed to be considered. Our Recreation and Parks has been making decisions early on to really make most of the things virtual, but they are in communication with our partners, our local partners like a CA or the Y, and our regional partners and our statewide partners, talking to all the recreation and parks. What are you saying? What do you think about opening? Okay, if we look at opening pools, how do we open pools in a way that, yes, we recognize that chlorine should kill bacteria, but a lot of people go to pools to hang out. And when they hang out in large groups and aren't necessarily physical distancing, aren't wearing masks, aren't washing their hands, how do we address that issue? And so those are ongoing conversations. And our hope, again, is to not only have guidance that is something that you hear, but something that you can implement and makes people feel that we're being thoughtful and we're keeping people safe.
Thank you. And so as we, obviously the questions continue to come in. And so one of the things that I'll just state for those that have continued to ask questions in the Q&A, certainly if we don't get to all of the, well, let me rephrase it. We will not get to all of these questions. But what we're doing at the chamber is actually, I have a couple of my team members that are tracking and recording the questions so that we can ultimately get them over to the county executive, to Larry, and we can ultimately answer and get back to you with kind of a Q&A follow-up, because again, we know that we're not going to get to all of these. And I can tell you that, some of these questions certainly are very thoughtful and certainly are insightful and so forth. So another concern that's being expressed, and at least that was mentioned in one of the many questions here, centers on transportation. And so I know the buses, I think, have not been running, but again, as more businesses open, can you share perhaps, I guess maybe a couple of things. One, what's being done, particularly from a Howard County perspective, in terms of maybe sanitizing the buses, and then also even as it perhaps connects to the greater regional transportation system, what might be done on that end as well, so that again, riders and those in the community that have to take public transportation at least feel that they can get to their work destinations in a safe manner.
So a few things. One, on the transportation funding piece, the allocation from the state has diminished, and we understand that there are funding priorities and difficult revenue challenges from the state level, and transportation has been one of the things that hasn't materialized as we had hoped. And so I think that there are difficult decisions being made at that level. On the local level, as we speak, the county council is voting on my proposed budget. And so right now there are amendments that actually cut some of the transportation funding there. We have, during this pandemic, curtailed some of the transportation. And keep in mind, we have our employees doing the cleaning, and we are still trying to make sure that we understand what are the most efficient and effective ways to do that cleaning. Even if we wanted to completely ramp up all of the transportation today, if we made that decision today, it wouldn't be able to actually be fully functional until June 14th. And so it will take time to completely ramp up a transportation system that has been ramped down for the last couple months. Just like any of your other businesses, there are things that if you wanted to ramp up completely, it's going to take some time. Bringing back employees off of unemployment, retraining them on appropriate procedures, purchasing maybe different types of materials than you had previously, more PPE, soap, sanitizer, things of that nature. And so it is an ongoing process that will take not only the human and the monetary resources, but better understanding how we can be more efficient and effective with what we have and keeping people safe as we continue to clean and look at the routes that people will need so that we can have the most efficient transportation system that we can have right now.
Thank you. And so quickly, just going through a couple of the other questions through the chat box here, or the Q&A rather. And so this is going to be specific, but I think it really speaks to a number of businesses in the county. And they want to know what would be the recommendations for an 11-person professional services firm located in an office park. Specifically, is it permissible for them to allow their employees to return to the office next month?
Next month. So unfortunately, next month conversations are difficult. Those of you, for example, who've gone through the PPP loan process, there were times where you would start in the morning. By the afternoon, there was different guidance. By the evening, there was entirely different guidance, and maybe the website had crashed. And by the next day, maybe all the money was gone. So it is very difficult to understand or to predict what happens next month. If we look at those, for example, metrics, if God forbid we have a resurgence and an outbreak, or some of our PPE that we anticipate that we've already ordered should come in, gets rerouted or delayed, anything could happen over the course of a month. I think at this time, what I would recommend is continuing to slowly reopen, bring on the people who you need, phase by phase, continue, and when you can, do some teleworking. If you have a 11-person firm, maybe 1 or 2 or 3 of them can work remotely. Or maybe, as they're talking about with the school system, some can come in on some days and have alternating A-B days or half days where some people are out in the field working on things. I think the only thing that is holding many of us back are our ingenuity when it comes to solving these problems, because every problem has a solution. Can't always implement it immediately, but every problem has a solution. And I think that if we work together on trying to solve these problems and we unite and focus on the actual problem, then we can actually develop a solution that works for people.
And I think as a follow-up, I think one of the areas of perhaps confusion is for instance, I think many businesses are certainly looking at alternatives like that. I know we are, even at the chamber with just our small staff, and looking at who comes in on what days. But again, I think some of the confusion is, I think first and foremost, are businesses, let's just say in an office environment, allowed to start having people come in, regardless as to whether it's using the same person or same firm, if it's an 11-person firm, whether they do 3 at a time, 4 at a time, 2 at a time. I think some of the confusion between shelter in place, safer in place, essential, non-essential, is who fits where and how do they ultimately make those decisions that, yes, I can have some of my workers come in, and obviously that business makes the decision that they, however way they need to make it, they would determine it. And so I think that might be more so what they're getting at is it okay for them to start thinking about how they bring workers back to the office?
They definitely should be thinking about it. And what I would recommend is any business owner who has a question, a specific question about a business, just shoot us an email and we'll get right back to you and give you the guidance. There are, as you very astutely indicated, many industries that aren't quite fitting into any of these buckets very easily. They might have 11 or 12 employees and 2,000 square feet of space, or 11 or 12 employees and 25,000 square feet of space, and it's broken up in a different kind of way. And some of them might be in a very vulnerable population sector, or they might work at different times. So shoot us an email. Let's start the dialogue, and let's see what we can do to help you be as successful as possible in this challenging time.
Thank you. So a couple more questions here, and this pertains to getting back kind of, I think, to youth or maybe group activities, because I think in some respects it could even pertain to adults. And that would be, right now, what's the conversation or status around activities for youth, such as, say, karate, dance for children, versus, and I would say them being able to do those types of programs outside in the event they can't do them inside. But are there conversations taking place around youth and small group activities like that?
Yes, there are numerous conversations, and again, germane to that specific industry, we're looking at fitness and health and what is outdoor and what makes sense and what can be done virtually and what can be done one-on-one with certain PPE and gloves and face masks. So yes, there is that important conversation being had.
And then also this question pertains to, any types of waivers. So specifically it says, will businesses that can open safely now, yet are not listed as approved for phase 1 or 2, have the ability, will they have the ability to ask for a waiver or a review in order to open sooner? Particularly if they might be a solopreneur and they're maybe only with one client at a time because they're, again, perhaps in an office suite versus maybe, again, being in a large office environment.
So I would recommend just reach out to us. You can always ask, and we're always going to try to work with every business who we can. So just reach out to us and let's have that conversation. For many businesses that haven't fit into the particular bucket, Oftentimes we said, well, come back to us with a plan. Some have come back, plans have been great. Some are working on those plans. And so reach out to us, let us better understand, and let's see if we can work out.
And so for these last few minutes, let's kind of look ahead. And so certainly right now we're in phase one, but as we have thoughts around phase two, I guess what maybe share with us perhaps the conversations that are being held with the governor as well as others around phase two, and again, whether or not Howard County may follow in line with the governor's plans for phase two, or better yet, are you hearing that the governor may take a different approach for phase two? And whereas for phase one, he allowed the counties to, in essence, chart their own course based upon the local data, but certainly we've read that there's differences of opinions, expressed by many as to whether or not that was the right way or should have been different. But let's talk about phase two and what conversations are being held there, and if you perhaps see the governor taking a different route as it relates to maybe what he allows you and your peers to do by way of decision making.
So let me just say, many of my team have not had a full day off, some in not just weeks, but a couple months. We have been working tirelessly. I know the governor and his team have been working tirelessly. What we saw in the announcement of reopening wasn't exactly what the governor had articulated in April. There were certain things that reopened in a certain way that initially in April were either going to be part of phase two, and he included in phase one. And, I recognize things evolve very quickly. He's probably talking to some of his industry folks. He's learning, his team is learning, we're learning. So I think the more that we can work together, the better things will be. We were notified about 30 minutes before the governor made his announcement about the details of what would be reopening. And so we haven't, now I've been with you all for about an hour. So I don't know, maybe he's reached out or his team has reached out and given us some details, but I don't know what the details of the announcement will be as far as 5 o'clock from the governor's office. That said, after the last announcement from the governor and us working on HOCO Rise, what we actually did was we looked at all of the phases and we started thinking, all right, next time when the governor gives us the opportunity, what should this look like? What could it look like? And began evaluation of our metrics, conversation with our health department, talking with some of the industry leaders about what their ideas were. And so my hope, again, as I know is with every elected official with whom I've spoken, is to open as quickly as possible, as safely as possible. So I think, we're going to see. We're going to see where we are. I think some metrics we saw over the last couple of days haven't been looking as good. Some metrics have been looking even better. And we're also, as you indicated, kind of weighting different things. It's almost like, your GPA. You might have 7 or 8 classes, and one class you get a really good score in on a test, and maybe that changes the dynamic. In another class, you do poorly on a quiz. And so it's no one size fits all. There's no one factor, one metric. We're going to keep working together, the county executives when we can, the governor, all of our business owners, and try to move things forward. Because I also recognize that when we don't, there's confusion, there is inconsistency, and that's not good for our businesses, our workers, or our customers.
Excellent. And so just one final question as we come close to our time here, and this just gets back to testing. And so and that is, will the county offer free testing for those who are not showing symptoms, since one of the main goals is to reduce the positive percentages to below 10% and hopefully 5%?
Excellent. And that is my goal. My goal is to get us to a place where we are offering diagnostic testing, and people are coming in. And as we see, whether it's with President Trump or some of our healthcare professionals, there are people who get numerous tests numerous times. So when we talk about the testing rate, it's not a one person and then you've had your test and you're never going to get tested again throughout this pandemic. Our goal is to have as many tests as possible for people when they need it. And as we noted, yes, there are people who are asymptomatic. There are people who, will fit into our positivity rate. And if we're only testing the absolute sickest people, we're going to continue to have a high positivity rate and people have what they need. We didn't have sufficient testing as a nation. We didn't have sufficient testing as a state. And we didn't have sufficient testing as a county to do that. We are getting much closer with each day as a nation, as a state, and as a county. And again, as we continue to test and evaluate the efficacy of serology testing, antibody testing, which ones have the fewest false positives and negatives and the most accuracy. These are all things that we hope will continue to grow in very soon and offer that for our entire community.
And so I'm going to maybe just take us over maybe by a couple of minutes and ask the final question, and that is, the chamber has a lot of very smart and experienced people, and so how might our members, or just even those that aren't members but that are participants in the business community here, how can they assist you with maybe providing various, whether it's resources, guidance, their expertise, or what have you? How can they assist you in terms of decision making and as you just solicit advice and insight and so forth?
I want everybody who wants to help us move forward to be part of the team. So just reach out. And there have been a lot of people who have reached out and said, hey, I have this connection to gowns, or this connection to hand sanitizer, or I have this access to this type of testing. And sometimes we've been able to actually make that purchase through procurement or that connection, or we've said, well, you don't meet this threshold of criteria, that our OEM, our purchasing office has set, or we need many more than you're able to offer, or we can't come in at that level, which is significantly higher, but you know what? We're going to partner with this other jurisdiction, and now we're going to be able to get 1 million X, Y, and Z. Please just reach out. And frankly, reach out to Leonardo, reach out to Larry, reach out to Jennifer. Send us an email. Let us know your thoughts, your ideas, your ways that you can help us move forward. We all know that the more constructive and productive of a dialogue that we can have collaboratively, especially with smart people who want us to be successful, that we can be more successful, that we can address these issues. And not only can we do that, we can do it in a way that works for more people. The more perspectives that we can have when looking at a problem, the more angles that people come at it with different ideas, different experiences, the better we can have a more thoughtful, thorough entirety of a solution that works better for more people, businesses, and our whole community.
Excellent. Well, thank you for sharing with us this afternoon, and again for your work for the Howard County community. Again, thank you all that have had an opportunity to participate and listen in today. Again, for those of you that had questions in the Q&A, please know that we will be going through those, and ones that we did not get a chance to answer, we will certainly be working on, and we'll get back to you as quickly as we can. I want to just remind those of you as well of just a couple of upcoming chamber programs, specifically tomorrow. So as we talk about preparing to open, the chamber's been doing a 5-part series on those topics. We focused on liability concerns. We've looked at facilities management, behavioral and mental health. We touched on education last week, just yesterday rather. And tomorrow we're actually going to have an in-depth conversation on childcare. And so again, these are all topics that will impact us as we fully prepare to open. I want to thank you for your continued support and our annual partners. Again, have a great afternoon and stay safe. And thank you again to Larry, Jennifer, and County Executive Ball.